But as we heard in the news earlier this week, the PEI Veterinary Medical Association is saying that Lyme disease, an infection transmitted by deer ticks, is now being diagnosed in dogs on the island. Well, it just happened that Dr. Marty Hobson came by to talk about ticks recently and brought along an animal friend with her. Good morning, Marty. Welcome to the studio.
Good morning, Mitch. It's great to see you.
Jake's not here.
Jake's not here. Gave him a day off.
Who's this?
This is Romeo, and Romeo is an eclectus parrot, and I'm just babysitting or parrot sitting. He may make some loud sounds during our interview, but I only have him for a couple more weeks, and I thought this was a great opportunity for you to meet him and see another type of pet that people could have.
When I first had my dog Scout, who can't hike anymore, but she's put in a lot of miles on hiking trails all over the Maritimes. I remember the first time I asked for, tick prevention or should I worry about ticks? I was told, don't worry about ticks unless you're taking your dog off island. That's changed now. It
has. We used to, like you said, years ago, tell people, don't worry too much about it. And part of the change is because of global warming. With our warmer weather, we're seeing more and more endemic tick populations. We used to think that ticks just came on migratory birds and ticks didn't live here as much. But now we know that has changed. And of course, when I say ticks, people automatically think, ticks go with Lyme disease. But a lot of people probably don't know exactly how those two fit together.
Yeah, what is that relationship?
Okay, so Lyme disease is actually caused by a bacteria called Borrelia and not by the tick itself. So the problem is the bacteria is inside the ticks in its little gut, actually, and specifically carried by the Ixodes tick. We used to call that the deer tick, and a lot of islanders thought, well, we don't have deer, so why do we have to worry about Lyme disease? But these ticks can feed on anybody. They'll feed on mammals, mice, dogs, cats, and even birds. And so now we call these black-legged ticks or Ixodes ticks, and we know that those ticks are here in the Maritimes.
How does it get passed along?
Well, so ticks are little arthropods, the same family as spiders. They have 8 legs, and they go through a few different life cycles, and they'll be a little tiny nymph like the size of a poppy seed, hop onto a host, that could be, say, a mouse. They'll take a blood meal, fall off, and then shed and turn into a bigger size stage and jump on a different host, and so on and so on and so on until they're adults and get bigger and bigger. So I brought in some examples, Mitch, actually, for you to take a look at. Yeah. So this one here, this is the common dog tick that we don't see very many of those around here, actually, but in the States you would. Now, those aren't, those are adults, but they're not fully engorged, and that kind does not carry Lyme disease, this Borrelia bacteria.
Okay. They're tiny, though. If I had a shaggy-haired sort of breed, that would be tough to find. Yeah,
they're sort of the size of a small watermelon seed, maybe. So, and you're right, it would be hard to find in a furry animal. This is an Ixodes tick or a black-legged tick. That one's a little bit pale. They can definitely be more brown than that, and that is the sort that does carry Lyme disease. Not all of them do, but many are positive for that bacteria that can cause severe illness. So you can see they're quite similar.
And the note on the specimen bottle says found in PEI. So
that's right. Now, the pièce de résistance are these guys.
Oh, my.
Yeah. So these are dermocenter ticks, and they're from a moose, so not on PEI. But can you describe how big those are, Mitch? I mean, that's just incredible.
They would be the size of a June bug, possibly?
Yeah. The person who loaned them to me said they were like olives in her description. So, I mean, they are just huge.
And olives with legs, mind you, but olives nonetheless.
Exactly. So the ticks we're talking about today don't quite get that big, but just for the gross factor, I brought those in so you could see them. And also, this great picture. This is an Ixodes tick, the kind that can carry the bacteria that spreads Lyme disease. So
rather scary when blown up to that size.
Yeah, super scary when you blow them up onto a big calendar page like that.
So why do we have to be so vigilant about this?
Well, the bacteria, as I said, lives in the tick, and the tick gloms on or attaches onto you or to your dog, and then it takes about a day or two for the bacteria to kind of crawl up the mouth parts of the tick and get into the bloodstream of the mammal. And we need to be vigilant because Lyme disease is a serious issue. And when I say be vigilant, my tips would be people should check themselves after they go through a walk in the woods or the grass, and check their animals regularly too. But as you said, they're so small. small, they're often missed. And when you find them, they're often engorged, and you don't know, did this tick attach to my dog yesterday or 4 days ago? So they're hard to find on dogs and cats.
So has the problem of Lyme disease been increasing in the Maritimes?
Mm-hmm. We've been seeing more and more of the Ixodes ticks that carry Lyme disease. And if you test them, a lot of the ticks are positive for the bacteria. So we used to think, like I said, that they didn't live here year-round, but now we know that's changed. And in fact, in 2014, the U.S. Environmental Protection Agency added Lyme disease to its list of climate change indicators. So the more Lyme disease we're seeing, the more we know the planet is warming up. The number of diagnoses of cases of Lyme disease in people tripled from the 1990s to around 2010.
So how are people getting Lyme disease? Can I get it from my pet?
No. A lot of people get scared by that and think that that's true. But a person gets it from a tick just like a dog does, from the bacteria that's carried by the tick. So if a person in your family was diagnosed with Lyme disease and a dog in the same house was also testing positive, it just means that the dog and the person were on a walk together and they both got bitten by different ticks. There's no way that the disease can spread from you to your dog or the dog to you without going through a tick host as well. So it can be devastating for people, and often it's not even recognized as Lyme disease for a while. You'll have fatigue and fever and joint pain and things like that.
That sounds like the flu to me.
It does. And the other hard part is often you don't develop signs for months afterwards. So in the wintertime, you could come down with an illness and not even be thinking about how in midsummer you had that tick bite, or may not have even noticed that tick bit you.
What should I do if I find a tick on my pet?
You should remove it, and you would do that by grasping it with tweezers as close to the skin as you can, down by the mouth parts, and pull it straight out. People talk about twisting it, but really you have less chance of breaking off those mouth parts if you pull it straight out, and then clean the area with soap and water. Ideally, you'd wear gloves while you did this, but if you don't, then definitely wash your hands well afterwards. And we used to recommend that you take all those ticks you get from your dogs, that you take them to your veterinarian, and we would send them off to be tested. And we don't do that as much anymore, although you can pay to have that done. That's still available to you through your veterinarian. But you see, if you get a positive result for that bacteria, it doesn't mean that your dog was infected. Maybe you pulled it off beforehand. Right. But the other side of it is, if that tick comes back negative, your dog could have been bitten by a different tick. So it doesn't mean that your dog is free of the infection, if that makes sense. So now we have a different little protocol, and we recommend that you wait 5 weeks after you found that tick on your dog, and that's the time that it takes to develop an immune response. And then you do a simple blood test, and that tests for antibodies to that Lyme disease bacteria. And if that's positive, it just means your dog was exposed. It doesn't mean that your dog is going to get sick. Actually, many dogs who are positive for antibodies to that bacteria never develop clinical signs. But if you do have that positive test, then you need to discuss with your veterinarian maybe some further testing or monitoring to make sure that your dog doesn't develop those signs, which are similar to people: enlarged lymph nodes, not eating right, joint swelling and pain, lethargy, and things like that.
And what is the course of treatment if indeed you're diagnosed with Lyme disease in your pet?
Actually, when it's caught fairly early, it's very simple antibiotics. But of course, with new issues concerning antibiotic resistance, if you said my dog had a tick on it, a veterinarian isn't just going to say, here's some antibiotics just in case. We kind of have to make sure we're, trying to be responsible clinicians, that we don't use antibiotics except in a judicious and beneficial way.
So I suppose the best thing is don't give that tick a chance. How do you do that?
Right. So prevention would be the key. So 4 things that you can think about are to prevent exposure. So people should wear long pants and jackets. It's a little harder with your dog. You do tick checks when you come home. So after a hike, you'd be going through your dog's fur, looking for things, especially along the ears or other areas where there isn't so much hair. Also on yourself, it's now recommended after a hike, take a shower right away so you get a good look, at yourself and hopefully see any exposed areas where a tick might have attached to you. And you can even take those clothes that you were wearing on the hike and right away put them in the dryer for about half an hour. And those tiny little nymph stages that might be crawling crawling around your clothes and just waiting to sort of attach, they would actually get killed by the dryer heat. So that's a new recommendation. For animals, there's tick preventatives, and there's spot-on treatments. Those are the liquids that you put on the back of the dog's neck, and that's usually done once a month through tick season, which is basically whenever the ground isn't frozen. And there's also new oral medications, again, given once a month, and there's a brand new kind that's once every 3 months. So again, there's so many choices out there. You'll have to talk about what are your concerns as a pet owner, what are the risks that your dog is going to go through, and what's best for you, and your veterinarian can help you with that. Finally, there is a Lyme disease vaccination. We don't see that given too often. There's some debate on how effective that is to protect against the bacteria. So really those tick preventatives are the way to go if you're concerned about ticks and Lyme disease in your dog.
Marty, thanks so much for joining us.
Oh, you're very welcome. Thanks for having me, and thanks for looking at all these beautiful ticks. I hope that you learned something, and thanks for hosting Romeo, too.
Oh, I appreciate it. Video Romeo, and of course more on our website at cbc.ca/PEI. That was Dr. Marty Hobson, a veterinarian at the Atlantic Veterinary College. Romeo providing simultaneous parrot translation.